I'm Dr. Sandeep, Director for Radiology and Imaging Sciences at Tenet Diagnostics, Hyderabad and Bengaluru. Tenet is a full-fledged diagnostic center which has branches in AP, Telangana and Karnataka. The cancers, especially in those who are more prone for cancers, such as people who have the habit of smoking, or people who have had significant familial history of cancers in their family or near and dear ones, are the ones who are more prone for cancers, and these are the set of people who need to be very wary of trying to figure out and trying to understand whether they have anything of that sort lurking under without their knowledge. Now this is an excellent tool where we have a system called whole body diffusion imaging, which is almost an imaging which is similar to PET scans, which can diagnose small lymph nodes or areas of abnormality wherever they are in the body, be it the organs or anywhere else. Now this is a scan which covers from head to toe, and it is helpful for the radiologist and also to the clinician to identify those areas which are not accessible by clinical palpation. That means your doctor may be examining you thoroughly, but there are areas where he cannot examine, obviously, which are hidden. So it can be in the liver, it can be in the kidneys, where there may be an innocuous looking lesion which one may not be able to understand through physical examination. And we are fortunate to have this technology called MR elastography. Earlier, you used to be aware of the fact that any tumor or any mass anywhere in the body needed to be interrogated by what is called as a biopsy. I am sure most of you are aware of that, and this biopsy involves putting a needle through into any of the space which had this area of abnormality and testing it under the microscope so that the pathologist can identify whether it is benign or malignant. Now this kind of a process is no longer necessary. For instance, MR elastography is an excellent tool, especially in areas like breast and liver, where we can effectively diagnose whether a lesion is malignant or benign purely by running the MR elastography challenge and not requiring any kind of intervention, not requiring any kind of needle to be put inside, thereby saving a lot of time, effort and pain for everyone. The accuracy is so much that now most of the surgeons are beginning to rely only on MR elastography, and in case a lesion turns out to be, or an area of abnormality turns out to be benign, they would just leave that and then follow up with serial imaging, trying to understand whether the lesion is behaving normally, regularly, or if it is increasing in size. Only if it is increasing in size does this patient need to consult any other person or need to get any other further tests done. Otherwise, if it is not increasing in size, the person can actually live with it without actually bothering on what it can be, and so on and so forth. So these are technologies which can be extremely useful and yet non-invasive, bringing out the diagnosis properly so that your clinician can be aware of what is the diagnosis of the lesion and then institute proper treatment. Thank you.
Thanks for watching this video. Like and subscribe for more videos.